Good evening, everybody. This is Representative Dean Phillips, and I want to thank all of you, actually thousands of you, who've taken the time out of your evenings to join us for tonight's conversation. I always say, as many of you know, that representation begins with listening, and we have a lot to talk about tonight. So if you have a question, you can press *3. Again, that's *3 anytime. And if you're interested in signing up for updates on my work in Washington and here in Minnesota, press *6. And a member of my team would be happy to get you all signed up. Again, that's *3 if you have a question tonight, and *6 if you'd like to sign up for updates from me in my office. For those of you who don't know me, I am a lifelong Minnesotan, a father, a husband, a business owner, former chair of the board of Allina Health System, and as of January 2019, your representative in the House of Representatives in Washington. In my first year and a half in Congress, I have now authored and introduced more than 20 bills and co-sponsored more than 400 bills, each one of which I believe would make life better for Minnesota families and American families, workers, and businesses. And like most of you, I am terribly disappointed by the tenor and tone of politics in our country and the inability of leadership in both parties. And I'll say it again, the inability of leadership in both parties right now to produce results when Americans need them the most, like right now. But I am working hard to do something about it. It's one of the primary reasons that I seek this job in the very first place. And that's why I'm proud to be an active member of the Bipartisan Problem Solvers Caucus. I was recently ranked the 27th most bipartisan member of Congress out of 435, the 5th most likely to sponsor a Republican bill, and I was just awarded the Jefferson Hamilton Award for bipartisanship by the U.S. Chamber of Commerce. And I've always believed that Republicans and Democrats have to return to placing people over partisanship, especially during these remarkably difficult times for everybody. The COVID-19 pandemic has brought unimaginable and unprecedented hardship to our neighborhoods and our front doors, but I'm on a mission to help get us through this as healthy and economically sound and prepared for the future as possible. To that end, I've introduced a number of bills over the past months specifically to deal with the pandemic, starting with leading the charge for transparency in the House of Representatives for the trillions of dollars in relief that we have passed in Congress since March. That effort of mine created an oversight panel for coronavirus relief money, which I'm proud to report became law as part of the CARES Act. I also wrote the Paycheck Protection Program Flexibility Act, which we passed just about 6 weeks ago, which reformed the Small Business Relief Program to make it work better for businesses. I also wrote the Truth Act, which endeavored to make every single one of those PPP loans, every single one of them, completely transparent. And I advocated to open up that database so every American can see where the money goes. Unfortunately, the bill failed. Unfortunately, my Republican colleagues voted against it. And as a result, the only PPP loans that we are now seeing are those that are over $150,000. Lastly, I wrote the Voter Notice Act, which would protect our elections and fight rampant misinformation around voting, which all of you know we're seeing a lot of. And if there is ever an election in which we need to notify people about how to do so safely, it is this election in November. You all know these are unbelievably difficult and unprecedented times, and it demands thoughtful but expedient action to save lives and protect our healthcare workers, our first responders, and provide a lifeline to workers and small businesses who are hurting and in desperate need of our help. And we've got to tackle this threat with a unified, and I stress, nonpartisan front. So I'm looking forward to hearing your questions tonight and your ideas, even your criticisms. After all, the only way we're going to get through this is to do so together. So once again, as a reminder, if you want to ask a question tonight, just press *3. And if you want to sign up for my newsletter, press *6. And if you're looking for information tonight or anytime, you can go to our website at phillips.house.gov which is an excellent resource. My team and I are always here for each and every one of you. So thank you for joining us tonight. And now it is my honor and pleasure to introduce our special guest this evening, Dr. Michael Osterholm. Many of you have probably heard his voice on the radio or seen his face on TV a lot during the pandemic. That's because Dr. Osterholm is a leading epidemiologist and is the director of the Center for Infectious Disease Research and Policy at the University of Minnesota. He is a COVID-19 expert, and we are very, very fortunate to have him with us tonight to answer your questions. So a heartfelt welcome and thank you, Dr. Osterholm. And if you might just take a moment to say hello and perhaps give us a little bit of an update as to what you are seeing relative to COVID-19 around the world, throughout our country, and most importantly, right here in our backyard in Minnesota. Welcome, Doctor.
Well, thank you. Good evening, Congressman Phillips, and thank you for having me. And I appreciate the opportunity to be with all the people on the call here tonight. First of all, let me just put into context where we're at. As much as it seems as if we've been dealing with COVID-19 forever, we are just really now going into our 7th month of this infection from a worldwide perspective. And if we look at the vast majority of activity in the United States, most of it's been in the last 3 months. When I'm asked where we're at in this journey, I tell people maybe the 3rd inning, possibly beginning of the 4th inning. We have a long, long ways to go yet in terms of the number of infections that we will see before we might have access to a vaccine one day that could rescue us from the disease itself. Globally, this is an event that not seen in magnitude since 1918 with swine flu. As of today, over 18.5 million cases have been reported worldwide. We know that likely represents only about 1 out of every 10 cases that has ever occurred. But to give you some sense, as it is a relative tip of the iceberg, what it once was a situation where we would see 1 million new cases occur over 1 to 2 months, we're now seeing 1 million new cases added every 4 days. And that number is getting faster and faster to the point where it's very likely in the near future we'll be adding 1 million cases a day. That includes, by the way, 690,000 confirmed deaths, which from the standpoint globally, again, is a real underrepresentation of what's happening. In the United States, our case number is about 4.7 million. With 155,000 deaths, we recognize here that only about 1 out of every 10 cases has been reported. This is based on studies we've done looking for antibody, or the fact that someone has been infected before and were not diagnosed at the time, but we can show that they have actually had this infection. And here in Minnesota, as of today, we've had 56,000 cases and over 1,600 deaths. And again, those numbers are going up. We had hit a peak here in Minnesota originally in May 25th. We had 707 new cases reported that day. And then, like many areas of the country, we saw those numbers begin to come down. However, the virus surely had not left us. And on June 19th, we had only 320 cases, down from 707. Unfortunately, today we're reporting over 710 cases. We're back at an all-time high. Our last week has been by far the worst week on record that we've had, and as has been, you may have heard in the news media, there's a number of states that are of grave concern right now that we're beginning to follow the footsteps of what happened in California, Texas, and Arizona in terms of the increasing number of cases. This, needless to say, is a real challenge. So what's happening worldwide with all of these cases? Well, as we predicted, some of you are aware our center actually put a note out on January 20th saying this was going to be a worldwide pandemic, that this virus was going to spread as it is now. We have really been tracking it and fairly well predicting where it's going to go. We saw a peak of around 30,000 cases in the United States reported back in April 17th. And then we saw the case numbers drop precipitously over time. And I say precipitously in the think that they dropped to 20,000 from 31,000 or 32,000 cases. Surely a drop, but not enough to at all bring this virus under control. And today we're going to be reporting over 65,800 cases. So we've actually gone from a peak to a drop to a kind of a trough and then to another peak much higher. And right now, cases appear to be leveling off at about 65,000 cases reported per day. And that is because, in fact, we see the states of California, Arizona, and Florida, those numbers beginning to drop pretty quickly in some of those areas, as literally they have been locked down in a sense with orders not to be out in public, and that has really slowed down the transmission. On the other hand, a number of other states, including Minnesota, are now adding cases in an accelerated rate, so it's kind of even. My best prediction is that what's going to happen with the opening of schools, particularly secondary schools in this country as well as colleges, we're going to see a major increase in cases sometime in early September that will take these levels of 65,000 to a much higher level than we have now. In addition, we have events. For example, the rally at Sturgis starting this week, lasting for over a week, I think is going to be a major inciting event around the country with over 275,000 people likely to attend that, with a lot of indoor bar activity. That I think is going to be one of several events that are going to really increase these numbers substantially. Where do we go from here? Well, our best guesstimate to date, and this is more than just a guesstimate, but an approximate number of about anywhere from 8 to 10% of the U.S. population has been infected with this virus to date. These people would have antibody, would be immune at least for the short term. For this virus to slow down transmission, it's going to have to hit at least 50 to 70% of the population. That's what we call herd immunity, where there's enough immune people in the population that the virus slows down its transmission because it keeps running into people who are immune. Now, we can get there through natural disease, which if we do, will be devastating in terms of the number of deaths and where this goes, or we'll get there with vaccine if we're fortunate enough. And so one of the things we really are concentrating on is reducing the number of new cases and deaths, and hopefully getting to sometime early next year a safe and effective vaccine. Let me just put this in final perspective. Right now in Minnesota, some of the highest transmission-related activity is occurring in greater Minnesota. Early on when this pandemic first began to show its head in the United States, there was a sense that this was really a pandemic of urbanized America, that in fact it was not going to affect all the country. And I made the statement back in February saying that this was not going to be a blue state or a red state pandemic. This was not going to be a blue county or a red county pandemic. This was going to be a COVID-colored pandemic. And that's exactly what we're beginning to see now, is that it really is being transmitted in a higher number in rural America, as well as continuing to transmit in the larger cities. And over time, I think you'll just continue to see this happen. Finally, let me just put it into perspective. In my public health career, I never hoped I would see this day, but I surely understood it. And March 1st, COVID-19 was not even in the top 100 causes of death in this country. By the middle to end of April, it was the number one cause of death by day in this country. Nothing has done that since 1918 swine flu. Deaths have come down since that time into July, but now we're beginning to see a very rapid march upwards, coinciding with people who have now been infected and been ill for several weeks and now dying. And it's very possible that within the next 6 weeks, we'll be back at that number one cause of death in the United States. That should give us all perspective as to what we're up against and why what we must do to deal with this pandemic is so critical. And I welcome Representative, your help with all of this and your support. It's obviously a critical issue for all of us.
Doctor, thank you. Thanks so much for the overview. And I'll just ask a couple questions to tee up the conversation. We have well over 4,000 people on the call right now, so I want to make sure we can get to as many people as possible. But on the subject of mortality, which of course is everyone's worst fear, clearly there are a lot of people who contract COVID-19 who are asymptomatic. Clearly, the evidence indicates that young people are not as susceptible, but clearly older people are, and those with underlying conditions are. Can you give us a little bit of a sense of what you see, playing out relative to the real mortality of COVID and how dangerous it is for those of us on the call?
Right. Well, clearly there are a recognized set of risk factors for once infected having more severe disease and even dying. Age and gender, being a male, is not good. So right there, I got two strikes against me. Those are increasing risk factors, but also underlying conditions such as heart disease, diabetes, certain kinds of renal disease, certain blood disorders, and in addition, increased BMIs, body mass indexes, have been a big issue, including down into young adults. So while the younger children, those in secondary school, colleges, young adults have not seen nearly the same number of deaths per number of infections, they do occur. But where we really begin to see the number of deaths pick up, and we're in this country now witnessing something a bit different than we've seen in Asia, where the obesity situation was not such a factor, but we're now beginning to see more and more younger individuals, 20s, 30s, and 40s, who are in intensive care, who are in fact also dying from this infection. So again, as I pointed out earlier, earlier this year, this was the number one cause of death in our country, and it's very likely we're going to see it again. Now, some people will say, well, you know, it occurs primarily, though, in people who are in long-term care or nursing homes. And, you know, they're going to die anyway. I hear that over and over again. Well, I would like to think that, you know, this isn't the reason they should die. But I wanted to make a really important point that early on, congregate care, meaning like long-term care, any institutional setting, or even a congregate work area where people are worked closely together, like meatpacking plants, that the challenge we had there is all it took was one infected person to come into the nursing home. So even if only 1 out of 500 people in the community were infected, if that one person happened to work at a long-term care facility or had a family member there and would visit them, once the virus was in there, it spread very quickly, kind of like putting a match to a can of gasoline. That surely upped the number of individuals who died who were in these settings. But what's happening is that we are unfortunately causing more and more of these facilities to have been infected, and many people either have died or are now immune. And while that's surely not universal, it's a growing reality. And what's happening is we're not seeing the deaths there nearly as much anymore, but rather in the general population, people who acquired in the community who have no idea where they picked it up. That's been one of the concerns about the growing number of cases in Minnesota. By far the largest number of cases now are occurring is what we call community-acquired cases, individuals who have been out and about but have no idea where they were exposed and infected. So I would just say that, again, from a standpoint of deaths, yes, it's the older population, but many of these are individuals. When we say older, I happen to know of a couple who recently died as a result of an exposure at a graduation party for their grandson. Both of them were supposed to be in Europe right now on vacation, and of course couldn't go. But they died going to a graduation party. That's the kind of situation that's going to happen more and more frequently.
So, Doctor, one more question, and then we're going to turn it over to those on the call, and it has to do with reopening. I'm a business owner. I believe many on this call are. Many jobs, of course, rely on our economy and businesses being open for business. But we have to find that thoughtful intersection between safety and speed of reopening. And when you look at the positivity rate right now, which is hovering around 5%, of course, in Minnesota, you know, what does that tell you as an epidemiologist, and how low would you like to see that number, that positivity rate, before you would recommend lifting restrictions on both businesses and gatherings?
Yeah. Well, to take a step back, when we talk about locking down or having, you know, basically put substantial restrictions on businesses, and I know many on this call have been severely adversely impacted by that, both as business owners and as employees. But, you know, the United States really never did it. We said we were going to, and then what we did in April and May is kind of a lockdown light. Well over 50% of our economy never really shut down. And then when we went from 32,000 cases to 20-some thousand cases, we kind of decided on Memorial Day, we're done. Pandemic fatigue set in, and we just said, okay, here it is. And as such, we just kind of released ourselves back into society. And as a result, it came roaring back. It was exactly the concern that we expressed at the time. Now, some places in the United States didn't do that, notably New York. New York, which was a house on fire in April and really was the epicenter of the major activity in the United States, did just that. They really did lock down. And as a result of that, they have been able to get the infections at a very, very low level in that state, not just New York City. And as a result of that, they are now continuing to reopen every day, taking their foot off the brake more and more. And they have had level cases for the last month. They actually had days this past week where they didn't have a single death in the entire state. And it's a lesson to all of us that unless you get this virus level down much, much lower than we currently have, we won't be able to control it with anything we do, whether it's test and trace, whatever we try to do. And so one of the challenges we have right now, this has been demonstrated by other countries in the world who also, like New York, did a really intense lockdown, got the virus down to these lower levels, and have been able to continue to maintain at those lower levels by now having the ability to test and trace. And without that, we're just going to continue to see case numbers increase. If you heard Neil Kashkari, the Federal Reserve Bank president in Minneapolis on Sunday's Face the Nation, he clearly addressed this head on, saying that the cost of this was going to be much more over time. If we didn't address the issue and try to get it locked down again and then get it to the low levels, we have at least 6 to 12 months potentially before we get a vaccine. And with that, during that time, we're going to see really very serious challenges in our communities with overflowing hospitals, unemployment going up just because of the inability to run businesses. Nobody is going to be out at this point. So I think the challenge we have before us is to how to make a decision. Do we basically, try to do this again and do it right, and then get through the next 6 to 8 months where we don't have to lock down, where we can open schools safely, where we maybe can think about having professional sports open to the public? Or are we going to basically just continue this, knowing that it's largely going to be a failure in terms of trying to control the virus?
Yeah, and as you all probably saw too, President Kashkari strongly encouraged Congress to not penny pinch, to ensure that relief and recovery are well provided for in the country. And rest assured to everybody on this call, that is my mandate and my mission. So with that, let's get to questions from those on the call tonight. And the first one will go to Kay from Bloomington. Kay, you're live.
Hi, thanks so much. My question is there any way that we can contain this without a stay-at-home order, or is that really the only answer, and do we need to proceed right away with that?
Well, let me just say that if we look at all that's been done so far to date in trying to really reduce the spread of this virus, which is easily spread by just breathing, just sharing air with someone in an indoor space in particular is more than efficient to transmit this virus. And so, I would love to give you the happy talk answer and just tell you, well, let's just try a little this, a little that, and maybe it'll work. I'm telling you right now, that is only at best going to very marginally reduce the number of cases. And we're going to see these cases continue. I mean, right now in Minnesota, here we are at the highest level. I can see once the schools open, colleges reopen, we get into the fall season, indoor air potentially overlapped with the flu season, where transmission will only be enhanced when you have one or both of these. And it's going to get a lot worse than it is right now. And for many people, they'll say, well, I don't really think it's that bad to begin with. I will promise you on this call tonight that if we don't do more, I'm absolutely certain that by the end of this year, every one of us on this call will know someone who we care about, who means a great deal to us, who will have been seriously ill with this virus or died. That's what we're up against. And when you think about where we've been just the first 6 months, the next 6 months are going to be much, much, much worse. And so that's, I'm not the message, I'm just the messenger. And we as a society have to decide how we're going to deal with this. Other countries have done it, and they've done it quite well. And they've still had to struggle to keep it under control. But controlling 200 cases a day is sure different than trying to control 65,000 cases a day.
Thank you, Doctor. Our next question is one that was submitted online by Chris Evans, and Chris's question is, I quote, "I will have a procedure at the university hospital. My wife and son are staying at home. All of us are negative. After the procedure, what steps should I take to protect them from the virus, and how long after contracting the virus does it take to show a positive test result?"
Well,
so
first of all,
how to stay safe at home and positive test results.
Yeah,
how long
well,
does it
that's
take?
a really thoughtful question in terms of trying to think about your others, there shouldn't be any reason why you should pick up this infection going in for a procedure. We are doing everything we can in the healthcare settings to avoid any risk to patients of picking this up in the healthcare setting. In terms of if you should get infected with this virus, you will normally be infectious between day 3 after you are infected up through potentially another week to 10 days after that. Most of those individuals who get infected are probably really not very infectious beyond the first 5 to 6 days of infectiousness. So at that point, if you were to go home, and again, remember, if you did pick it up in the hospital, which I, again, feel confident you don't have a high risk for that, remember, you would not get infectious yourself until day 3 or so after you were exposed. So if you got exposed on the morning before you left, you wouldn't even become infectious till day 3. If you got infected when you first went in, you might be infectious when you go home. But at this point, I wouldn't put that as a high-risk issue for you to deal with. In terms of your family, within being out of the hospital and back home within 7 to 10 days, there's no risk of you transmitting the virus to anyone after that, even if you had a mild or asymptomatic infection.
Thanks, Doctor. Our next question comes from Joel in Minnetonka. Joel, you are live.
Hello, I'd like to ask Dr. Osterholm. In March of this year, you mentioned on CBS this morning that cleaning and avoidance of touching is way overblown. And I was wondering if your opinion has changed in the 4 months since. And also, why do the experts in South Korea and other countries continue to suggest cleaning? Touching anything.
Yeah. Again, I can tell you that if you look at the epidemiology of this disease and where CDC and other groups are, in fact, there's a really very thoughtful article that was published in this last week's issue of The Atlantic called "Hygiene Theater is a Huge Waste of Time." And, we have historically seen, particularly in the Asian countries, this emphasis on environmental cleaning, whether it's influenza or it's this virus, whatever. But again, I feel confident from all the epidemiologic studies we have here that fomite contact, or the inanimate objects, plays little to no role in the transmission of this virus. This is a respiratory transmitted virus that we're very concerned about, and I sure recommend hand washing, etc. I deal with a lot of other infectious diseases that hand washing is a very important part of. So I don't want to minimize that. I just, at the same time, I think we've made people paranoid over the risk of contracting this virus from goods that come from the grocery store, packages that come, and that's just simply not the risk experience that is what is the reality.
So, Doctor, on that subject, we've got we're in August now, fall and winter, unfortunately, forthcoming. Indoor versus outdoors, and how things might change when we have to be back indoors, and how airflow, filtration, and the like impact transmission.
Mm-hmm. Well, outdoor air is a gift to us right now. This virus is rapidly dissipated into the air, and we surely can enjoy that. So being out in parks, in settings, this is the best time to do that. It's a good time for backyard barbecues if everyone agrees that they'll stay, 10 feet or more apart. You don't have to sequester your life to the point of becoming a recluse to effectively deal with this virus. But again, we don't want people getting close, and unfortunately, far too often in the social setting, that's what happens. But I can't recommend outdoor air more than the fact that I try to get it every day, and it's the one thing right now that keeps my mental health probably in better shape than it would be otherwise. So I urge that. Indoor air, it's a problem. the recirculation of air, how often does air changes occur in a room. Many locations you get 1 to 2 air changes an hour. And work that we're doing on the virus right now in terms of looking at infectious dose and transmission suggests that it may be necessary to have many more times air recirculate or renew air an hour than we have now. So I worry about what we're going to see come fall. And I think this is going to be, a greater challenge, and we recognize that now. So this is why we want to try to get the virus under control and keep it clearly as low as we possibly can.
So, Doctor, on that subject, I hadn't thought about this before, but those of us who live in apartments or homes that have heating and air conditioning systems with fans, that you can either switch them to auto or on full time, is there any evidence to suggest that it might be a little bit safer to have that on the on function so that air is constantly being circulated?
Well, yeah, the challenge we have with HVAC systems is just because the fan's on doesn't mean that you're getting new air. It's all about how the systems are set up. They may be recirculating air, but not necessarily giving you new air. And that's the challenge we have, is we want to basically have new air come in and replace it. And so, you'd need to check with your HVAC expert for your location to see if you turn your fan on continuously, what does that mean in terms of actual the new air incoming.
Okay. All right. Well, our next question is from Eric in Chanhassen. Eric, you're now live.
Yeah. Hi, Doctor. I had a question about the contact tracing. You were saying that the number of cases need to be lower. How low does it need to be to do that? Because with the high level of unemployment we have, it seems like there will be a good program to institute, and I haven't heard anything about that. Thank you.
Yeah, thank you. That is really an important question. I exactly how low you have to get it before it becomes more effective is unclear, but many of us believe it has to be at least at 2 per 100,000 cases per day, which is almost more than just about 3 times as much as we've had over the course of the past couple of weeks. And again, that number is increasing. So it really, you have to drive it down. And then it matters also how quickly you can get test results back. We are having a major challenge right now with our laboratory support services around the country. This is something I first wrote about last April, saying this was going to happen. Wake up. We've got to start preparing our country for supply chain shortages, which has now happened. You get a test result back 8 or 10 days later to then go and do a contact tracing on someone is useless. It's absolutely useless. And so we're working on this issue. Public health is to try to deal with this. Right now, we need a national leadership plan on it, for which we've actually been quite short on that, of how would we support these supply chains? How do we get the testing to the people who need it? Our group put out a publication several months ago. It's on our website at our center, the Center for Infectious Disease Research and Policy at the University of Minnesota, or known as CIDRAP, and it's on smart testing. It's testing the right person with the right test at the right time for the right result to get the right outcome. So a test result, like I said, that comes back 8 to 10 days later is not the right result. Using the wrong test. We've had people who are using tests that lack in sensitivity, or they actually find a positive, and then making people feel like, oh, I'm negative by this, therefore I'm not infected, when in fact they are. And so we need the right tests also. So if we did that, that would help us get to a place with contact tracing that would surely improve our ability to do a good job. Now, I will have to say at the outset, remember, up to 40% of the cases are asymptomatic. So I do know that, in fact, that we still are going to have a challenge, even if under the ideal conditions of contact tracing and trying to identify people quickly and getting them isolated so they don't transmit to others. With the number of asymptomatic infections, I don't want to kid anyone and say that testing and contact tracing by itself is going to stop this, but it's another tool that we can use to overlay on our armamentarium to fight this, and we can do that if we get the number of cases down to that level.
And just so everybody's aware on the subject of testing and tracing, the countries that have managed COVID the best in class, are clearly those that had a testing protocol and a tracing regimen ready to go and quickly deployed. We've been playing catch up, and even at this point, still don't effectively have one in place. For anybody who is showing symptoms or worried that you may have been exposed to someone who has COVID, just to let you all know, my wife and I just returned from Washington, called Alina this morning, and we're able to get in and get tested. And the little insider tip for everybody is that they told me that oftentimes people cancel their appointments on Mondays, which opens many of them up for last-minute callers. And if you go in on Monday, the tests tend to get back sooner because it's the beginning of the week. So for those of you who might need to get one, a little insider tip there. Our next question is from Andrew in Maple Grove. Andrew, you're now live.
Hi, Representative Phillips. I didn't get to say this before, but thank you for all of your hard work during this time. The question that I have is more geared toward you, but Doctor, feel free to answer it if it applies. What is being done on the national level to get all 50 states and all individuals in the country on the same page in regards to how we react and move forward regarding this virus?
Well, Andrew, I'll start since you directed the question to me, and thank you first for your kind words. And I don't think it will surprise anybody when I say that our country did not respond in a way that I think is both necessary and expected for the United States of America. And the lack of the administration taking it seriously in the early days, the lack of thoughtful, principled, intentional, and expeditious leadership, which should be done by encouraging people to work together rather than simply handing the reins over to others, has been very disheartening to many of us. And I speak for Democrats and Republicans in Washington who are very like-minded. And now we're playing catch-up. Just like our health system in this country, it is not a health care system, it is a sick care system. And I've never seen better evidence of that than right now what I'm seeing in our country, Andrew. We do not have a system, and that is becoming woefully and painfully apparent. With that, I think Dr. Osterholm might have some thoughts on what should have been done, and frankly, what we should do to prepare for the next time, because I don't think this is unfortunately the last time we'll be facing a virus of this magnitude. Doctor?
Well, thank you. And thank you for the very, very thoughtful question. You're exactly right. I mean, this is a public health issue, and it should be a public health issue in what we do about it, how we respond. And unfortunately, it has been an issue that has sharply divided our country relative to recommendations made for public health action. I have been nonpartisan my entire life. I've served roles in the last 5 presidential administrations. Worked for 2 Republican governors, 2 Democratic governors, 1 independent governor while I was at the state health department. And, my job is just to basically say this is what we know and don't know from a public health perspective. This is what we must do. And it's been very challenging to operate in this pandemic in that mode, just because of the fact that I have found myself in the middle of an issue between 2 extremes, and only to find out that I'm the one that's extreme because I'm in the middle. I think that's the challenge we have to have today. And as a society, I know it sounds very naive. I'm surely been around long enough not to be naive, but it would help a great deal if we could just get people on the same page to understand that we're trying to save each other's lives. And this is not about individual freedom or power. It's not about the fact that, someone's we're trying to restrict something. We're trying to make reasonable recommendations that are about trying to control this virus transmission. And that's been a real challenge, but we'll continue to do it. I don't ever have to wonder why I get up every day to do what I do. I have 5 grandkids, and it's very easy to understand why you get up and do that. And we all need to think about how we can contribute to responding to this in that same way. What would we want for our kids and grandkids?
Thank you, Doctor. And just to remind everybody, if you want to ask a question during our call, press *3. Again, *3 if you want to ask a question. And if you want to sign up for our newsletter, press *6. Again, *3 to ask a question and *6 to sign up for our newsletter. Our next question is going to be from Ms. Roshonda Dunn from Coon Rapids. You're live on the call.
Hi. Well, I live in Anoka Hennepin School District. So I got an email saying that we have an option. We can either do hybrid and distance learning together or just distance learning. And I wanted to know which one of those, is it safe to do both or is it safer to do distance learning? Because we have a choice and it's kind of like confusing because we have that choice. So it sounds really, the numbers are really high right now. But to give us the choice to go in, is that safe to do both?
Yeah. Well, first of all, let me just back up and say that all of us recognize that there's probably no more difficult issue in our communities right now than the issue of schools and the safety of our kids. I have just completed 3 weekly podcasts on this over the last 3 weeks, having done a great deal of work in it, talking to superintendents all around the country, teachers all around the country, parents all around the country, urban and rural, et cetera, trying to understand the issues at hand. And I can tell you right now that, having kids in school, particularly those in elementary school, is really an important time, not just for their learning, but their emotional and mental health, in many cases, for healthy foods, et cetera. We want to have our kids in school. The challenge we have, of course, is that number one is if the kids are there in the younger age in particular, we don't see them having significant illness associated with this virus. Most people don't realize we never shut daycare down in this state in March. We've had child daycare running the whole time. We've not had one outbreak in a daycare facility that resulted in any kind of significant closure or healthcare or a daycare provider serious illness. And so we know that with younger kids, we're in better shape. Now, clearly we have to understand that when we get into the older kids, into secondary school, they are more likely to be more like adults in terms of getting infected and transmitting the virus. And particularly in that setting, as well as some in the younger kids, I don't want to minimize it, we have to think about our teachers and staff. Today, 1/4 of all Minnesota teachers actually have an underlying risk factor for a serious COVID infection should they get infected. And so how do we protect them in that setting? So one of the things you're seeing are choices that are about hybrid learning, distance learning, or in-class learning, all related to the age of the child and what is the background infection in the community. I have to applaud Governor Walz. I think he did a remarkable job working with the health department, with the Department of Education to try to come up with a plan that really accentuates on the expertise of the local school district. Nobody knows the schools better and the populations in that school district than the school itself. The superintendents, the teachers, parents, etc., coming together with guidance, and that's what the Department of Health and Education did, was give locations guidance as to this might be why you'd want to consider here to only do distance learning because you have so many cases in the community it's likely to spill over into the schools. Or, in fact, you can go ahead with classes in school because there's a low enough level in the community it's not likely to spill over into the school as such. So I can't answer the question for you what's safe and not. I just always tell people nothing in this world is safe. Before COVID happened, if you put your child on a school bus every day, there was a chance that school bus could be in a terrible accident on the way to school and that child could be seriously injured. It's a very low risk, but it's not perfectly safe. There is no low risk here that most people would find satisfactory. If one child would develop a serious infection with this virus, I understand. As a grandparent of 5 kids, oh my, do I understand that issue. But at the same time, having said that, we have to move on with our lives. And so I'm very supportive of what this plan is in Minnesota. And I would just say that I think when schools can be open, they should be. I do worry about the secondary schools, and knowing that I'm at the University of Minnesota and I'm actually a member of a board of regents of another college in Iowa, I understand the higher ed challenges. I think we're going to have real challenges there, keeping people from getting infected. So the last thing I would just say, and this is one where, again, Congressman Phillips has been very helpful. Our schools in this country desperately need federal support right now to open up as safely as they can. As we all know, K through 12 funding has largely been a local issue, a state issue, but you know the hemorrhaging that's occurred in those government levels in terms of trying to provide support to schools. And we need to get the legislation passed. The House has done their job. Congressman Phillips was part of that. Thank you. But we need to get it done, because I can tell you right now, schools around this country are in desperate need for additional resources to try to get protective equipment for school teachers, to try to get the kinds of learning materials they may need for distance learning, et cetera. And so I would put faith in your school district. I actually believe that that's where you should go with it, and I think they'll do as good a job as anybody can.
And to tag along on Dr. Osterholm's comments, I know we have many thousands of you on this call representing a wide diversity of political perspectives, and I want every one of you to know that if there's one thing on which every single member of Congress agrees, from the most liberal member to the most conservative, it's that we want to see schools open and we want to see businesses and the economy reopened. The only differences of opinion are relative to how quickly to do so, what support we need to do so, and how to do so in the safest manner possible. And those are important conversations, and that's why I'm glad that we are doing this on the phone tonight. For those of you that joined the call recently, I'm Congressman Dean Phillips. I'm speaking tonight with Dr. Michael Osterholm, answering questions about the public response to COVID-19. Our next question is from David in Eden Prairie. David, you're live.
Hey, hold on one second here, sorry. Yeah,
Sure.
I've been building a retaining wall at the same time, so I want to appreciate your efforts.
You deserve an award for that.
Yeah, 25-foot wall. It's a lot of backbreaking work. But to get to the point quickly, the biggest thing I see is my family's split along political lines. I find myself more in the middle. What I see a lot is one extreme saying it's government overreach of a mask. The other side is too scared to go out anywhere, right? It's two extremes. So a lot of what I'm seeing is a lot of disinformation out there on social media, even comment boards. There is a foreign element there where something will get 40 likes within a second with a negative mask comment. And that's just not, being a computer scientist myself, that's just not possible. So there's some foreign element that is, trying to further divide us and everything, plus the disinformation effort we're doing ourselves naturally. What do we plan to combat that and treat it more like a seatbelt? Seatbelt save lives, click it or ticket, that sort of thing at a national level, like that crosses partisan lines. Do we have any plan for that?
Well, let me just say, I'll just start and say, you're absolutely right about the scientific information. You can have your opinions, but there are really one set of science facts, and, that doesn't change. Our center has been committed to being as truthful and as honest as anyone can be on data. We're not tied to anybody's position. We're tied to the data. And so I think that I would urge you to come look at our center's data. It's kept updated every day. We have an entire news team. We keep the latest and most current information available on that site. This has been a challenge. I probably spend, without exaggeration, 1/5 to 1/4 of my time just dealing with rumors of untrue scenarios or untrue statements about what's going on. And that does make it much more complicated. And so I think that, again, we can do our best when we all come together and try to help support this, moving this on with the best data. And I can just tell you that we will continue to do that without regard to partisan politics or a given position. Our positions are only the ones that are supported by the data.
And I'll add to your question that one of the beautiful truths of America is that we're the land of the free, and that when you live in the land of the free, it's incumbent on each of us as individuals to look out for one another. And I have long considered our country to be compassionate, enlightened, and caring about one another. What troubles me about mask wearing is that there is nothing more patriotic in protecting our fellow Americans than wearing one. This notion that it is a personal decision is irrelevant, because wearing a mask is about protecting your neighbors and people you encounter. And to the extent that we can explain that to people is important. I can tell you that in Washington, in Congress, there are only 2 or so members of the Republican Party who are not wearing masks these days, one of whom just contracted COVID-19 last week, Louis Gohmert. So I do encourage everybody to do so. What makes this country unfortunately unique around the world right now is that a lot of our countries choosing not to look out for our fellow Americans, and that's troublesome to me. It's troublesome probably to many of you on this call, and I would encourage anybody to please wear your masks whenever possible. Our next question is coming from Anne in Maple Grove. Anne, you're live on the call.
Having on masks. I don't understand why there are not enough N95 masks, to my understanding, that then aren't just protecting others from you, but then you get some protection from others who are not wearing masks and aren't social distancing. And I just can't believe how our healthcare workers have been treated not having enough personal protective gear. And I feel like our schools, our teachers, our students, our staff, if they're going to be going into the buildings, they should be able to have N95s as well. For those of us who are concerned about wanting to vote in person now that there's all this controversy about the United States Postal Service being able to handle mail-in voting, I'd like to go vote in person so I know it counts, but I'd like to have an N95 mask to do that. Now, I know there's other priorities. Essential workers, they're going every day. They deserve to have N95s, the healthcare providers, the schools. Why can't we have N95 masks available for everybody?
Well,
Doctor?
First of all, let me just say that you've hit a topic that's very, very near and dear to my heart. I think most people would be surprised to learn that there are over 1,400 healthcare workers in this country who have died as a result of COVID infection. And while not all of those were occupationally acquired, many were. I don't think people realize what it's like to be on the front lines today of intensive care medicine in particular and treating these patients who have COVID infection. And a very real reason for their the conditions we're seeing right now with healthcare workers is a lack of adequate personal protective equipment, namely an N95 respirator. So I get that completely. My daughter is one of those physicians who is on every day, puts her life on the line at work around this issue. So please understand, I get it. Why is the problem what it is? What people didn't understand is that today to manufacture something, you just can't snap your fingers and make it happen. You have to build the machines that make these kinds of things. And we didn't have a national plan to accelerate the kind of work that we should have been doing in March and April. Probably, and I'm not sitting here saying, aren't I great? Please get this, but it's a sad moment. Back on January 20th, when we came forward and said this was going to be a pandemic, I made a public statement. Later that day, I met with the leadership at 3M, the largest manufacturer of N95 respirators in the world. And I said, this is going to be huge. You have to immediately gear up and use every machine you have and start making N95 respirators. This was in January 20th. It wasn't until 6 weeks later that the first U.S. official contacted 3M about making N95 respirators for the pandemic response. But in the meantime, they had done it anyway, based on our previous work. And, they produced millions of extra ones. Now, the problem is 3M and companies like that are operating at full tilt right now. They're producing everything they possibly can on the machines they have, and they have increased their number. But what we didn't do is prepare beforehand. You can't suddenly make millions and millions and millions of something that you need at the moment it's there. Far too many Americans think you can just go press a computer screen, hit the button, and it's delivered the next day. And for a lot of things that works, but for these kinds of things it didn't. And so I completely understand your frustration. It is mine. But at the same time, the reality is that we never then did lay out a plan in January, February, March, or April, or May, or June to then decide how are we going to get this additional product produced? Where's it going to get made? I'm working right now with a group of entrepreneurs from the Silicon Valley who have just devised a new material that has all the same qualities of N95 respirators, but can be washed up to 300 times and can be reused day after day. And we're trying very hard to get this out to the public, literally at almost no cost, just so that, in fact, they can have one of these and reuse them, and in a way that you can't even currently reuse the ones that are being made. So I can't tell you how right you are on this topic. It's right on the mark. And it's one day we'll look back and say, boy, we sure could have done a lot better had we been better prepared and responded in a timely way to this very, very issue.
And Ann, just to let you know, at the federal level, many of us, Democrats and Republicans, are appalled by the fact that our national stockpile was poorly attended to, almost totally ineffectively managed, and almost useless. And two of my Democratic colleagues, along with 3 Republican colleagues, introduced a bill in April called the Maiden America Emergency Preparedness Act, which would start a national commission on preparedness for national emergencies and ensure that we have robust supply chains, ensure that we have plans in place to make sure that whether it's N95 masks or ventilators or any PPE, personal protective equipment, is available and most importantly made here by domestic vendors, because as many of you know, we have outsourced way too much necessary equipment and materials, and we have to bring it back. Unfortunately, it is very difficult right now to, once we move a bill from the House, and this one was a very bipartisan one, we need to get a vote first, and then it's got to go through the Senate and signed into law by the President, and that is awfully complicated these days. But it is on our minds, and we intend to be prepared and do whatever Congress can to make sure we're prepared for next time. With that, we're going to take just a slight break, and we're going to move to our second poll question. And that question is, do you support Minnesota's mask mandate as a way to protect others and slow the spread of COVID-19? Again, do you support Minnesota's mask mandate as a way to protect others and slow the spread of COVID-19? And now we are going to move to our next question, and it looks like it is from Deborah, who submitted a question online. And her question is, if a vaccine was made available today, how long would it take to manufacture enough of it to immunize the entire population? Doctor?
Yes, well, what is happening right now with the vaccine research and development and the manufacturing of the vaccine is unprecedented in terms of availability. When you've often heard that it takes usually 5 to 10 years to do what's being done in months, that should give you pause to wonder, is it being done safely? And that surely is a challenge that those of us in public health are doing everything we can to make sure it is safe. But what has happened is the federal government has invested in vaccines that may never actually happen. And what I mean by that is that if you were one of the finalists in terms of this program, Operation Warp Speed, the government is actually buying vaccine from you now. So they're actually making the vaccine that they're using in the research studies in such a way as to have it warehoused and ready to go should the studies actually show that the vaccines are safe and effective. So we expect clearly by the end of this year, many of these vaccines that still may be in the final stages of research and development will actually have anywhere from 200 to 400 million doses of vaccine in the warehouse ready to go on day one should the vaccine be approved. That still doesn't mean it's in your arm. A vaccine is a vaccine. It's not really anything significant until it's a vaccination when it's actually in your arm. But that too could be expedited. So I think for many of these vaccines, if we are able to show them to be effective and safe, they would be ready to go in fast order in terms of being delivered to the public.
And everybody, I forgot to tell you how to vote in our poll, so I'm going to repeat it right now. And if you want to do it, the question was, do you support Minnesota's mask mandate as a way to protect others and slow the spread of COVID-19? To answer yes, press 1, and to answer no, press 2. Again, that's, do you support Minnesota's mask mandate as a way to protect others and slow the spread of COVID-19? Press 1 for yes and 2 for no. Next, we're going to move to Hans from Eden Prairie. Hans, you are live on the call.
Thank you. Congressman, I'm 73 years old. I'm high risk, 3 heart attacks, 2 strokes, diabetic, got all of the risk factors. I'm also a substitute teacher, and I'm scared to death that I have to go back to work. Given that the money just ran out, those $600 a week checks were what was keeping my family afloat. I was somewhat appalled at both sides that this hasn't been resolved. I'm also appalled that you guys didn't agree to at least the 1 week extension, putting another $600 in our pocket. Why not? I mean, something is better than nothing,
Sure.
I think.
Yeah, well, Hans, first I want to express my empathy and I want to express my gratitude for being a teacher, and especially in light of these circumstances with COVID-19. So I hear you, and I share your disappointment. I am ashamed that the leadership in both the House and Senate continuously finds themselves unable to resolve the most important issues that we face. But Hans, I also need to let you know that 2 months ago, literally over 2 months ago, in May, the House of Representatives passed the second relief bill, the second big one, called the HEROES Act, which extended the $600 unemployment insurance, along with state and local funding, along with small business funding, so many of the things that we need so desperately. 8 weeks ago, that happened. And now we find ourselves, of course, at an impasse, and it troubles me just like it does you, and I'm disappointed because I think we need to do better than that. I'm working with my colleagues, Democrats and Republicans, especially the freshman members that are new to Congress like myself, to completely redesign this terribly dysfunctional system because it's inexcusable, it is appalling, and that's why I'm trying to do this. The way to do it, though, is from the inside, and if I have the time and I can inspire my colleagues, which I think we are starting to do in the future, we will do our best to elevate leaders on both sides of the aisle who can get that good work done. We have to continue the $600 unemployment insurance. The reason, Hans, that it's not happening is, unfortunately, those negotiating on behalf of the President, Steve Mnuchin and Mark Meadows, and then Mitch McConnell in the Senate, are refusing at this point in time, and we just had an update today, to approve a $600 unemployment extension. They're proposing $200. I find that unacceptable. President Kashkari from the Federal Reserve, many others, Republicans and Democrats, are demanding that we continue that program because it is the only thing in our estimation that can keep people afloat, keep our economy afloat, and help people like you, Hans, to at least get through these difficult days until we're through it. So I'm sorry, and I'm disappointed, and I share it, and I'm going to do my best, as I did today, to express my disappointment and encourage thoughtful agreement as expeditiously as possible.